Hello, I'm Joseph Alpert, Editor-in-Chief of the American Journal of Medicine, and I'm here to call your attention to what I think is another very interesting article in the AJM. It's from the Karolinska in Sweden. The first author is Kadesjo, who is one of the faculty members there at the Karolinska. And this article is about patients with acute myocardial injury and the effect of statin therapy on that. So let's take a moment to think, what do you mean by acute myocardial injury? Well, we know that anytime we see a patient and they have an elevated troponin, that's a myocardial injury. But it's not a myocardial infarct because there has to be clinical evidence of myocardial ischemia to make it a myocardial infarct. And there are many settings, for example, often in our intensive care units where patients are incredibly sick, there are myocardial injuries, that is direct injuries from the high dose of cytokines and catechol and so forth that are circulating. The COVID patients are perfect examples of that. They're not having heart attacks, they're having myocardial injuries. There's not ischemia involved. They're being damaged just like the kidneys are damaged, an acute kidney injury from the situation that's going on with their illness. In any case, in Sweden, they track every single patient who's been in a coronary care unit in the Sweetheart study. And they look back to see if patients who had myocardial injury, if any of the drugs that they received had been of benefit. And the only drug they found that was of benefit was high intensity statin. Now, the numbers showed benefit, but it wasn't quite statistically significant. But there have been other examples with, for example, the Myocardial patients, the myocardial infarction without significant coronary disease, who also seem to have benefited from statins. Personally, I think it's no surprise. There are many patients with asymptomatic coronary disease, and of course, they would benefit from being put on a statin. So that's probably why these numbers are going in that direction, but at least it's cheap and safe. And so it suggests that when you have somebody with a myocardial injury, it might be a good idea to treat them at least for a while with a high dose statin and then later decide how much coronary disease they have. At least that's the strategy that I follow in my practice. It's a pleasure talking with all of you. Please stay in touch with us from using all of our social media and our website. Thank you very much for reading the American Journal of Medicine.